Let's look now at the thoracic cage, sometimes referred to as the bony thorax. It consists of the sternum, also referred to as the breastbone, the costa or ribs, and technically the thoracic vertebrae to which the ribs articulate or form a joint with. However, in this discussion, we're not going to talk about the vertebrae because we've already talked about them. You have 12 ribs, regardless if you are male or female. The first 7 ribs articulate directly with the sternum through what's called costal cartilage. We have cartilage articulating with the sternum rather than bone to give some movement and flexibility here so the chest can expand as you inhale. These first 7 that articulate directly with the sternum are referred to as true ribs. Ribs 8, 9, and 10, notice they have costal cartilage that doesn't articulate directly with the sternum, but instead they sort of all merge together, and then they sort of merge or fuse with the costal cartilage of rib number 7. So we refer to them as false ribs. Notice that ribs 11 and 12 don't articulate with anything on the anterior side. And so we refer to them as floating ribs. Now technically they are also known as false ribs. However, if I ask you what type of rib is this or this, 11 or 12, I'm not looking for false ribs, I'm looking for floating ribs. And that's the only thing I will accept. Are they technically false ribs? Yes. But what I'm looking for is you to know that these are floating ribs. Now let's look at the sternum. So this bone here is called the sternum. It has 3 bone features that you need to know. The manubrium here is the superior most portion, sort of looks like a men's necktie. The middle portion here is simply known as the body. And this inferior portion, which sometimes resembles a arrowhead, is known as the xiphoid process, and that is xiphoid with an X, not a Z.